Now we'll move to consider approval of the agenda. In the case of an emergency, items may be added to the agenda by a majority vote of the Board of Directors. Emergency is defined as a work stoppage, a crippling disaster, or other activity that severely imperils public health, safety, or both. Items on the agenda may be taken out of sequential order as their priority is determined by the Board of Directors. The board may take action on any item appearing on the agenda. Do you have a motion or any adjustments to tonight's agenda? I have a motion by Valdez and a second by Goodsell. All in favor, say aye.
Aye.
Any opposed? Any abstentions? Motion carries. Now move on to item 6, public comments. At this time, the board will hear comments on any agenda item. If any person wishes to be heard, they shall stand, address the board, identify themselves, and state the subject for comment. Time limit for each speaker is 3 minutes individually per item to address the board. Individuals who wish to speak on multiple items will be allowed 4 minutes in total. A total of 15 minutes shall be allocated for each item for all members of the public. The board may find it necessary to limit the total time allowable for all public comments on items not appearing on the agenda to anyone meeting to 1 hour. Do we have anybody here for public comments? Stand. Mr. Rubin? Oh, nice. Can you tell us what document you're referring to? Sorry to interrupt you. You're referring to some document that UCSD. Thank you, Mr. Rubin. Your time is up. Do we have any other public comments? If not, we'll move on to item 7. That's just, oh, it has my name instead of Proctor's. Yeah, instead of Proctor's. Yeah, do we have any brief reports on meetings or events attended? Or any reports by Education and Outreach?
Our committee is, our PR representative is busy putting together the messaging at this time for our community in beginning to voice our slogan, Stronger Together, in anticipation of us all coming together eventually here. And then so those efforts are already underway, so we can hit the ground running on that. And then also the newsletter will be established by then as well. And so we'll have a monthly newsletter going out to anybody who subscribes to it. And so that'll be something that we strongly urge anybody in our community to register for. And also it'd be a great tool for any of our public representatives as well who have constituents who voice any concerns that want to be up to date on things. That newsletter will be one of those tools that they can utilize as well. That's my report.
So, and then report by AB 918 negotiation ad hoc committee. We did receive an asset transfer agreement from ECRMC, and our legal team is reviewing it, and we have meetings to discuss that. We also have a draft of a JPA agreement with UCSD, and those negotiations have been going very well. And that's pretty much my update. And then, all right, with that, we'll move on to item 8, consent calendar. Any member of the board may request that items for the consent calendar be removed for discussions. Items shall be acted upon separately in meeting following approval of items remaining on consent calendar.
Didn't somebody ask about having like a P&L profit and loss on one of the companies a while back?
Yeah, we, then why don't we pull the expense report and then just have it reported on at our next meeting?
Yeah.
And then for the meeting minutes, can we make that adjustment to swap?
Yeah, I think meeting minutes from the April 10 board meeting will be corrected to indicate Director Proctor's vote out of the closed session instead of Director.
Okay. I guess if there aren't any other questions, then I would go ahead and make a motion to approve the consent calendar with the expenses having been pulled for the next meeting and the minutes corrected as directed.
Do I
I'll
have a-
second.
I have a motion by Goodsell and a second by Garcia. All in favor, say aye. Any opposed? Any abstentions? Motion carries. We'll go on to item 9, action items. Item A, presentation and discussion regarding proposed IVHD organization chart under combined hospital system.
That Pablo and I worked on based off of where we're currently at. And we'd like to get any feedback, questions, anything like that that you guys have based off of this organizational chart. Ideally, what we'd also like to do with this is everybody's okay with it, is to be able to get that out so that everybody knows the direction. Again, part of getting people ready for change and what that change will look like, and kind of this is a very broad overview, right? It's not granular. From this, it will become more granular with those different kind of the blueprint that starts.
Chris,
Yes, sir.
so on some of these positions, are they duplicative to what PMH, or I guess, does both PMH and CRMC have the same positions? Are there some that don't either?
Yeah, there are a couple on there. So for example, and technically it doesn't exist now necessarily, but the patient, vice president of patient and ancillary services, there isn't a person in that position.
at ECRMC, we have somebody at PMH that has that. And so they're not necessarily across the board where we have some of the same positions. That's another one that we don't have at PMH, for example, would be the chief medical officer. Have that at ECRMC. That's not a duplicate position. And then previously we had inside legal time. They were not the chief legal officer position, but essentially. And other than that, one of them that we have that they don't would be the skilled nursing executive director. We have that position because we have the skilled nursing, currently MC does not, and so they don't have that. Some of them are positions that both locations have, and some of them.
For your benefit, on the screen in front of you, I put up the current org chart that this board approves in February. If you want to do like a comparison.
So these positions you're talking about, that. First former, or
Yeah.
not, we keep them.
Yes, so that was part of the process that Paul and I went through to see, okay, what do we have, what do they have? How do we make that work? Like what will need to be in place? The other position that we see that's not at either location at this point in time is the COO position. So that's the other position. And again, that's the only one that I would say that's new on there. The other ones either exist in both locations or just in one location or campus or the other.
So maybe it's premature, but at this point, say you do have a position. And
You can comment on there. That's a great question. When we look at this, so for example, we do have chief nursing officers, we do have chief financial officers. And in those situations, you'll see that underneath there's a vice president of finance, there's a vice president of services. And so that is where that other one that we have, one of those the people in those positions would be taking one of those spots.
Is that at the same salary?
That's what we're trying to assess.
But the AB 918's plan was to save on it.
Yeah, I think we've talked about that before, where realistically, the administrative cost is very, very minute. It's budget dust as far as what it's actually, what the other savings will be. When we bring these two facilities together, it's really gonna be an all hands on deck approach. We're gonna need everybody that we have. Most of these positions, that like some of those spots, the plan would be through attrition, that those would be changed. So for example, if we have, with the financial officer, for example, if the chief financial officer leaves and the vice president of finance moves up into that position, then we would have that discussion. Do we actually need a finance? And then not, then we move that from position. Any place where we kind of have some of those duplicative services, that would be the question that would then be asked at that time is, somebody leaves that position, do we fill that position? In some cases, that's already happened. So we have some positions like at PMH, for example, that we're not filling. There are positions that we need, but we're not filling those positions because in the end, we only need one person in that position. And there is somebody currently holding a position like that at ECR. So it wouldn't make sense for us to hire somebody that 6 months later have to make a jump.
A couple examples that in the image they had a compliance like president of compliance. That person left. Our group decided not to fill that position. Somebody at ECRMC had to do. Anyway, position. That would be saving. Yeah. Christian, when you talk any sense, probably.
And don't forget, these are, because the sizing of the two hospitals is not gonna change. So you're still gonna be operating two full hospitals that need full staff. And so, I think what I had anticipated, what I think we had discussed is at least initially, better safe than sorry, keep folks working, so as to not impact, recall the goals of AB 918 are also to not impact or reduce the accessibility of healthcare. So it may seem like an opportunity to whittle down, but it's just two hospitals that need to be full staff.
Another question. Adrian. What between the chief medical officer and chief of staff, and are they both paid?
The chief chief staff, a position elected by the mayor.
I know that.
The CMO, the chief medical officer, is a position that is a certain organization have way to do ways to they thinks that the staff it takes schedule things that
And that's a position, right? It's a doctor.
yeah.
It's more of that administrative function that it's, like Paul said, they don't have time to do the normal setup, and so a CMO, that's basically all they're doing. And representing like the physician side of that and giving that voice as we make this.
So the chief of staff does what? He's just a figurehead?
He's in charge of the safety. Is with the this. And vetting that through the committees. Therefore, executive committee. The CMO job.
Got a question about that, in line with that. So these leadership positions that you
It goes back to the. They're specialists. Fascinating.
think to be in a position
And
requirement
they're
that both of you, if we have the situation and hospital at that time.
so
Because I'm assuming that since we have two identical hospitals, that we're gonna have duplicate positions.
So and the board's gonna have to pay on this, but the way I envision is having the bylaws, right? Same for both entities. And the privileging process be the same for entities. It apply to by services at either location, but the bylaws will be the same. So we are in the process of seeing what the bylaws are for each bylaws are, and then updating that and taking that through the medical community.
Ideally, one of the things we would sort of have as well is just one med step, not two separate meds. I think that does make it full to your point because if that's the case, there's definitely duplicate services at that point in time. I know for us, many of our providers, and I'm sure it's the same at ECRMC, that are in the that are required as far as medical directorships, not much for them to do. And so being able to do that in both locations is possible. So that would be part of one of the things that's more beneficial to the community and to the hospital, have a single med staff instead of.
So like one med exec committee?
So say we had a cardiologist. And have two, would that person have to be certified to head of it?
If they're for a medical directorship, like you said, they either have to be board certified or eligible. One of the things that we have in this community in particular that's quite interesting is, there's a lot of bickering with our providers and a lot of, pointing fingers and kind of like, somebody did me wrong, and so I'm going to make sure that people know that X about them, and they're not board certified. They used to work for me, but they were fine working for me. But now that they're gone, not working for me, I'm going to make sure that everybody knows that this isn't the case about them, or that's not the case about them, and I'm not okay with them doing that. There's a lot of stuff like that because it is a smaller community. So if somebody leaves from there, some people's feelings really get hurt, and so we have to deal with that quite a bit. Unfortunately, but that is the reality of where we're at. And so I know for us, it's something that we watch and monitor very closely. We have a credentialing committee that monitor, or our credentialing team with our med staff. They watch all of that stuff. They're on top of it. If somebody's any of their credentials lapse, they'll pull them right away. They make sure they'll make me aware of that. I sign off on stuff on that kind of thing. Like there's a team that's built for that. And the way that the bylaws are written or the way that certain things are written, some of them will try to use that to their advantage when it works to their. And so we see a lot of that happens in here more than anywhere else that I've been. I think it really kind of comes from that because they've all kind of worked together in some way, shape, or form, and then they all get upset with them because they leave or somebody does whatever. And so those are the types of things that we unfortunately have to deal with. Seemingly, maybe.
And I ask because if we are gonna be merging and we have a higher standard at one, say El Central Region or PMH, we have a higher standard than we do at the other org. And if we're gonna be promising the community better healthcare, then we should probably set the standard at where you have somebody that's board certified.
Absolutely. And that's part of the process that we're going through as we look at things from the wage scale to our policies, to even, having a discussion about how, like, we're accredited through DMV, they're accredited through Joint Commission. So all of those things we have to kind of look at and say, which one are we going to pick? Why are we going to pick that? And that's another priority. But it's to that point right there. Like, we want to make sure that we're doing it's going to produce the best results and the best outcomes, and we'll make our decisions based off of how we feel that will play out.
And I know you guys already do this, but I would just ask one last thing. When you guys are thinking about these positions, well, look at them as positions. Family, each one of us that you guys will be impacting, so I would want to think that last resort would be to go away with a position where somebody's filling it, whether absorb it. But just remember that every position is a family. Look at it that way, kind of. You should look at things.
Yeah. Any other questions on the work part?
So you said this is a draft essentially?
Okay.
Uh-huh. And when are you bringing the next one?
If there's no changes that like, anybody sees that we would need to go back on, and we've probably gone through this for months, to get to this point. So if there was some sort of change that we missed that you guys were okay with, then from that standpoint, we would go back and make that adjustment and then bring it back or approve with that adjustment being put in place.
We would contemplate bringing it back for approval, probably close to closing, right? When we're very close to closing on the actual merger of the two. Right now, it's still just planned.
So the,
So Adriana, if we wanted to make that change in the bylaws where that provider is board certified, when do we do that? If we change the bylaws to make issue,
Yeah, something for us to discuss will be in terms of timing. Once we get the ATA approved and signed and engage in the, and start engaging in the closing process, will be, bringing items to the board probably immediately before closing. And then there will be probably a board meeting on the day of closing so that we can do resolutions, et cetera, that may be necessary to clean up, basically to unite everything. So it would be amending the IVHD bylaws to provide for both campuses. Amending whatever the strategic plan, the org chart, all of our organizational materials to encompass both campuses. And we should do as much of that ahead of time as possible with the implementation date as, you know, October 1 or whenever actual closing is going to happen.
and the part that you're talking about, with the bylaws for the med staff, it's different setup, right? So before it gets to this point and comes here, that has to be approved by the med staff. That's, the med staff will have to go through that process. They'll have to change the bylaws. They'll have to approve it. And then it comes here, and that's where you guys, as a board, have that opportunity to say, well, we don't like this as part of it. It needs to change, or we're not approving it. And you guys can pull it at that point, but it has to get to you guys from them first, before you could make a change or something like that, because they have to. They before.
Yeah, because something we're gonna have to do as part of the overhaul is, you know, unify HR policy, employee policies, for example. And so that means looking at ECRMCs, looking at PMHs, deciding who's we're gonna go with, marrying the best concepts from the two, and then putting together one single cohesive employee handbook or this policy or that policy. And again, in my perfect world, that would happen in the month or two before closing with an implementation date for the target date of closing. So that will be a lot of work.
So this, if there's issues with this, that's why we want to be able to have that discussion now. I said, Pablo and I went through this pretty thoroughly. Patty's given her blessing on it. We'll bring it to you guys as well. Because as we go forward, part of the process in the transition, right, will be to start to have people understand what it's going to look like. And so if everybody's good with that, even though we won't be implementing it and technically approving it, this would be what we would talk to people about. This is kind of the structure that we envision with this playing out and how that would look and where people fall, if you will. And let people know what to expect as we go through this process.
Yeah, and envision it as sort of like a funnel technique where it's like you've got to start with the real big picture concepts first, which is why the presentation to the board of the org chart makes sense initially, the joint CEO presentation at the next board meeting, because that way staff doesn't get ahead of the board in terms of vision. And then once we understand and are on the same page with respect to vision, it can start funneling down to all the specifics that need to be, okay, well, then this is going to need to be changed, and that is going to need to be changed. And so that's sort of the way to visualize it.
Do we need to vote on this? Okay, perfect.
Just for discussion.
Just if there was something glaring that something we missed, we would want you guys to point that out so we can make adjustments.
You're good. Do you have any comments? Nope. Thank you, guys. Appreciate it. I'll move on to the medical staff report, recommendations from the medical executive committee for medical staff membership and or clinical privileges, policies, procedures, forms, or other related recommendations. Who's going to present this?
It's right there in front of you, essentially, those are the reappointments that we have. On here, we do have some initial appointments, already on the feed, that we talked about last time. You're gonna see a lot of those coming through. And then a couple people that are released, proctoring, and those are some of the things we talked about last time, just as a reminder. When somebody comes in and they're very green in something, typically what we'll do, the med staff will say, we're gonna be okay with this, but we want them to be proctored under so many procedures or whatever, so that somebody else can look at that and say, yeah, they know what they're doing and they're okay with that. And then once that happens, whether it's time frame or whether it's X number of surgeries, procedures, or whatever it might be that they want to get credentialed for, privileged for, then they get released. So these folks here have been released from their proctoring, and then had some resignations and also change in staff. Sorry, it was courtesy staff and now we've got good staff. Those are the pieces on there. And of course, the policies that they have put in there for acceptance.
Can I ask, so I looked through, I have a couple of issues with the policies. So if you look through them, a lot of them still say Pioneers Memorial Healthcare District, and then like the letterhead on them is still the old Pioneers one. And that is on. But yeah, I pulled it. I mean, there's several of them, right? So the fact that I would say childcare disaster plan, the hospital evacuation plan, shelter in place, work care violence prevention plan. So if you look through, it says changes have been made, but they weren't. And so I have a really hard time even grasping that these policies were even thoroughly reviewed. And then also on the telehealth form, it talks about like creating a new privileges for telehealth, right? Telemedicine, telehealth privileges. It's still all Pioneers Memorial Healthcare District. So again, same kind of issue is how are these reviewed and how are these new if they still say PMHD, right? And then the fact that these are like emergency response plans and it doesn't seem like they're very thoroughly reviewed. And they're also for compliance. So actually and then also usually since this is supposed to be presented by whoever's the chief of the medical exec staff, is there a reason that he has not came to but only one? So if he's not here, can he make sure that he has somebody in place to present this so the board can actually ask questions to that person and we're not bombarding you? And then I mean, personally, I would like to pull from this everything but the privileges, and then they can bring these back when they've reviewed them and done it correctly. Some of them are done, but most of them aren't. Yeah. Yeah. So I want to pull all of them. Yeah. So let's pull all. Well, they didn't. No, they didn't. It still says like, I'm going to show you right here. Right. Yeah, right here it says PMHD workplace violence, right? You go through the document, it still says PMHD all throughout it, right? I mean, even on the red lines versions that we got emailed to us, they're not there. So, I mean, this is super. I mean, if I'm being honest, like I don't have a word for it other than sloppy, you know? When these items are presented even to the med exec, they should be ready for board approval. And when they come here, they should be ready to be presented and for approval. Like we shouldn't have to be going through and going, did you do this or did you not? It's not acceptable.
These are the ones that they approve. We're not technically coming to you for, those come separately.
Sorry.
The med staff said, yeah, we're good with these policies. So there's still another thought that it goes through. And then it ends up as an actual action item on the agenda for you guys to approve. Like you've seen them listed out
Mhm.
before. We'll take this list that they've had and we'll make those adjustments like you talked about. You're not technically approving these policies from the vet. They approve the policies to move forward. So they have to move from there and then it goes on to the separate sheet that comes to you guys for.
I even,
Then why even attach them? You know what I mean? Then why is it even coming to us? Because clearly whoever's on this committee isn't, I mean, they're not paying attention. They're not reading these policies. Like, there's no reason they should even have been approved at the med exec committee, is what I'm
Well,
saying.
but there are.
Executive committee and then. And that's how you. Sure. Things should have. Picked up.
Yeah. Yeah. No, no worries. I'm just like, I'm trying to be like frustrated. Yeah.
To get everyone on it and like every other stuff that we're off. And in lieu of that, you also threw in the whole merger, like now with like. And so there has been fallout, that has happened. Our process has gone from manual, getting together as a group, to now wanting to do electronic. And then to add to that, we also, medical staff requested that, any policy that affects them has to be them and that they collaborate on. So now that's an addition, that has been added to it. So it's made a process that we did a pretty good job on. It has kind of up in the air and made it, but we are getting better at it. Not apologizing for us missing that. Then it used to be ordinary, now it's the executive that's it last, where it goes to the different. And so now we have the task of being those many eyes that were crossing all the nodding, all the eyes, now it's us. And so I take accountability for that, because that's the reason I want.
So something that jumped out at me. Example on the vouchers and management. Yeah, George. And then on the silver, on the code silver, if you look at the last page where you talk. It talks about US Department of Homeland Security active shooter, how to respond. And it's got a date of 2008. Almost 20. I know, coming from law enforcement, that there's a lot of different guides, calls that are used. And then I also don't see any mention of SIMs. The FEMA, when you start establishing an incident command post for you have to have standards and SIMs and NIMS standardized so that all the local agencies and emergency personnel respond. I think that I would feel more comfortable if Mr. Mendoza was here, although you guys had a little to me, because he'd be the one to answer any questions that we may have, updates in the law, updates and guides and things like that, especially when it comes. And the last thing we would want is to go off of information from 2008, where some of the agencies are already updated and go information from even 2015. Katie, what did you say you wanted to do?
I think we just want to do
Just the privileges, 1 through 5.
1 through 5. Because I will actually point out that under the recommendations, he is asking for us to approve the policies and procedures as noted and authorize the CEO to sign any documents to implement the same. So I would make a motion that we accept and approve the recommendations 1 through 5 and ask that 6, I don't think
6
the
and
others,
7.
6 and 7 would be brought back to us. And I will say that sometimes, when you're dealing with legalese and legal documents, if one part of it can't be trusted, then you can't trust any of it. So I would just ask that there'd be more care and concern when these things come before us, because if you can't catch the glaring issues, that makes me wonder what else is there that wasn't caught. And, this is not my purview as far as me having the education to read all of this. I definitely am grateful for Mr. Proctor and his legal background, because obviously he had some catches as well. So I guess that's my explanation of why I'm making the motion the way I'm making the motion. So that would be my motion to accept and approve 1 through 5 and remove 6 and 7.
Do I have a second?
Second.
I have a motion by Goodsell and a second by Berker. All in favor, say aye.
Aye.
Any opposed? Any exemptions? Motion carries. Now move on to item C, discussion regarding date change for May 22nd, 2025 regular board meeting.
And then the following Tuesday. But you guys also about it. Training on the 29th, special case, which is I have 2 separate meetings that week with finance as well.
I would say I don't know if I'd want to do a training and then,
Hmm.
is it just a monthly finances or is it a budget? I think we can just present the finances at the next meeting instead of changing it. I mean, I don't know.
We have the meeting on the 8th. Has the potential to be a good long meeting. And then we would come back June 12th. And I don't recall, Carly, if June 12th or June 26th is gonna be the budget.
Yeah.
May 22nd, we're talking about taking May 22nd off count. Yeah. So May 22nd item, and usually this fourth Thursday of the month is done for the purposes of bringing
Finance event.
finance and med staff, which is generally third week to this board meeting. So do we know if there's any items happening on the May 14 med staff meeting that would need to be brought to the May 22nd that need to be approved before you?
I guess yes.
Can we do that on the 20th
Yeah.
That'd be so.
and not do the finance?
Mhm.
Yeah, so I think the suggestion on the table is to just move the regular meeting of May 22 to May 29.
Okay, and can we put it at 5 p.m.? Will be training as well.
Keep it limited.
Yeah. No presentations.
I will have- If you website, there's that calendar of regular board meeting dates. So we'll cite that to indicate that the regular board, well, you should make a motion.
Perfect. Do you have a motion?
I so move.
I second.
I have a motion by Goodsell and a second by Garcia. All in favor, say aye.
Aye.
Any opposed? Any abstentions?
Change the date of board meetings to reflect May 29 at 5 p.m.
p.m.
start time for the second May, right?
Perfect. Now we'll move on to item D, approval of amendment to independent contractor agreement with Progressive Healthcare Incorporated.
So this is, it's helping with the child paperwork. Process as well. That, we had a ceiling before at, $50,000. For that being done there, so this is just an amendment to that policy to.
It's a pretty straightforward amendment. I've looked at it, Progressive has looked at it. We drafted it to mirror the other amendments that we've been doing. And, sometimes with consultant agreements like this, it's just done on a time and material, like an hourly basis. But since this board has felt more comfortable historically, like having a cap and then just raising it, that's all we're doing here, is just raising.
Do you have any questions or comments from the board? Do you have a motion?
There's agreement between IVH. For consult.
I'll second.
I have a motion by Goodsell and a second by Garcia. All in favor, say aye.
Aye.
Any opposed? Any abstentions? Motion carries. Now move on to item E, approval of amendment to independent contractor agreement with Venture Public Affairs and Strategy.
Did one before, one has, continue to use his services and like to continue.
This new amendment just pushes the termination date out to January 1 of 2027. Yeah, so this is something you can review annually if you want. Similarly, at some point you could, if this is something that you want to be an ongoing thing, you could eliminate the deadline or the termination date and just have going agreement subject to termination. Or something you look at year to year.
When is the current contract over?
It technically already is. It already
It
expired.
technically expired December of last year because it was drafted to be a 4-month agreement. But we continued working with Frank on a month-to-month basis. So this is just a catch-up.
Have, public relations officer, H or?
No. Sheriff's does things. It's actually being done by committee, right? That's the same situation, kind of like we talked about before. I'm gonna hire somebody because. So, contract like this with Frank and then Alex, they fill the gap and that happens.
So if we merge with ECRMC, we're gonna have a duplicate with public relations, right?
So we don't have we have like Frank is a consultant for us, so we don't have an active at PMH right now.
But at
But
ECRMC,
they'll take over for Frank and for Alex. When we come.
But
So-
you're right, Director Vonda, if at some point the board or the, executive CEOs feel that it's duplicative, there's termination provisions that allow us to terminate with, I think it's 10 days notice. Or maybe 30 days, but there's termination provision, you can eliminate the contract anytime.
so it's not binding for the whole.
Correct,
Okay.
it just kind of naturally would terminate at the end of January, or I'm sorry, in January 1, unless you choose to renew it. And that's just to give this board an opportunity to evaluate, more frequently, like once a year. Do we still want these services? Are we still happy with this consultant or not? But it's looking like we're gonna close, for example, September, and the teams have decided, okay, this is one consultant we're not gonna need effective as of close, and we know that close is gonna happen September 1. Then August 1, we can give 30 days notice, we can say, hey, September hits, then we won't need your services anymore. If that's what the folks wanna do.
And you have the other, just so you guys are aware. Yeah, but, the other contract that we have, up with that, the website and their graphic design, that we do. That contract there is no out in that contract, and good for another 2 years.
Contract?
One with Alex, that's the other side of it, graphic side and website.
Is there a reason that there's all these contracts we keep hearing about that don't have like termination clauses in them?
I don't know the answer to that. That's not a normal process. It was drafted by the I was, so we have the same thing with the desert review. That has no out.
No outlaw?
There's no outlaws in there. And of course, the big one, is the one. For your contract.
No out on a 40-year contract.
40.
40, yeah.
40.40.
Yeah.
That was the previous attorney's work there?
Definitely wasn't mine.
I don't know how that one was, 'cause it's been in place now for about, so it could have been free or. Jefferson, so, we still have 30 some years.
Yay.
Back to Alex, does he collaborate with Frank when?
Yeah, so, prior to that, they worked obviously, because that's who PMH is using that. And so I brought Frank and him together, we talked about how we're gonna make this work since his contract is the way it is, and, services need more services than what he does offer. And so, like I said, all the graphic work, all of that type of stuff, the stuff that Frank says he doesn't do, that Alex is good at, those are the things that we're having Alex do, and Alex can man those pieces. The other side of it is if, like when the piece that we're putting together right now, the video, for Stronger Together, that is, Frank and his team that piece too. Other contracts, so when we look at, opportunities for billboard usage, anything that we're gonna do on TV, radio, that kind of stuff, procuring those type of advertising. Frank is the one that helps that part of it. Go out and we've had a conversation like, yeah, we want that billboard, procure the billboard. Then put together what it wants to look like, and then Alex does the graphics for it.
I'm curious, what is the desert review? If
The
we're,
way
if we're
that
paying
that
if we're paying advertising and
Yeah.
websites and all of that, what are
on
they?
on their, in their paper app, ad page.
And then, okay, so then does the price of that ad go up every year or
No,
is it
it's
set?
it's that whole time.
That's just-
I think, remember right, around month, because I didn't say exactly.
Oh my gosh.
One,
Who does the advertising for PMH right now? Contract.
Um,
There's,
we had somebody, they're gone now. We didn't have anybody in place, and so, when they left shortly before I got there, so then I was manning that and then Frank helping with that. And also the other stuff that goes out in social media, that kind of stuff.
and I'm asking because, on AXO, AM, there's an advertisement for PMHD. That's still going on. And, at the end of the advertisement, it says, if you want more information about Pioneers Hospital, go to the website pmh.org. On that website, the directors are us.
Sure.
And it is for PMHD. It's not for IVHD.
Right, and the IVHD website, links to that website. Right.
But I mean, we're not Pioneer directors. I mean,
Your
PMHD.
directors- Right, but you're technically directors, IVHD is directors for that, and so,
For Pioneers,
correct,
but not for PMHD.
right, not for PMHD.
So-
And on the website address is pmhd.org. That hasn't changed, but on the website, it doesn't say Pioneers Hospital for Healthcare District. That's all changed. So on the website, when you go to it, it says Pioneers Memorial Hospital. It doesn't say the Pioneers. And that one is being, like that one, they're gonna do a changeover with like the new coloring and all that. That will actually happen Friday evening. Again, like if anything happens, it'll everything get out right, and there's not as much traffic. So you'll actually see, go there Friday evening or Saturday, you'll see the change in the layout. It won't have the pink color to it. We'll have IVHD colors in it, but it will still be MHD. But the rest of the stuff, everything else, that's what it makes too.
Is,
On the radio.
Chris,
It has-
Chris, I'm looking at the website right now. It still says Pioneers Memorial Healthcare District. PMHD.org. You go, and then it goes to Pioneers. Yeah,
And right below it, it has Pioneers Healthcare District.
And then it has us as director of PMHD.
Well, how quick is Alex at doing work?
Well, again, they did it from Big Refresh. They're doing it in the background with all the colors and stuff. And Friday night,
So we'll look at it on Monday.
or Friday night, Saturday. No, we're looking at it.
Chris, could you put together a list for us, of all these contracts? What really concerns me is the 40-year contract, when there's a lot of other media organizations out there that would. Cheaper.
that's for the clinic.
Huh?
That's for the clinic in Calexico.
Or the 40-year one?
Desert License.
Oh, Desert Review, 7 years? That's still a long time.
Yeah, it is.
Yeah, could you prepare a list for us to look at all?
Yeah, we can do that. It's gonna be a very, very dear bill. Yeah.
I know.
It'll be fun.
Yeah, but so what happens is when normally, and we've talked about this before, when you take over an organization, you'd like to know exactly where you're at, so you can start making changes. But if things are adding things or what have you. So, yeah, seven contracts that I ever dealt with, it would be 2-year contract, but then there would be cost 7 years or.
They only let you extend it 1 year at a time,
No.
twice, and then they're
Yeah.
done. Ran into that a few times.
If you could start working
And another thing I will request is, Mr. Salazar and Mr. Alex come before us and give us updates they're doing.
And then, I would,
It is, I mean, we can ask them, it's technically not written in their contracts for that, they're consultants, they're not employees, but we can ask them to do it.
And I had a second look at the contract and it's actually a termination for so
Yeah.
there's no date,
7.03.
notice that you have to give if you want it.
Article 7.
7.03.
yeah,
Article
Um,
7.
So was this a big plan to make Frank's contract look really good, telling us about all these other ones?
Right?
I just wanted to make sure you guys, as we talk about this one and as the situation plays out with RMC, this one obviously is for us to deal with. That other one will not be. And so I want you guys are aware that I was gone.
Yeah.
So, but yeah, Frank's probably.
do we have, like, I know, like, on the desert review, for example, it's still like PMHD. Is there like, and then he mentioned the KXO, like when those are gonna be revamped?
Those are all things that,
Perfect.
yeah, that is.
Listen, perfect.
How your contracts looking, man?
I was gonna say, I think that's part of closing in escrow.
I'm sure he's already with.
Yeah. Dave's hacked them all up.
I didn't bring, Elon Musk.
Oh, my.
Next subject. That's too
Okay,
political.
on that note, I would make a motion that we accept the amendment to the independent contractor services agreement between IVHD and Venture Public Affairs and Strategy for Public Affairs Strategy Services as presented.
I'll second.
I have a motion by Goodsell and a second by Garcia. All in favor, say aye.
Aye.
Any opposed? Any abstentions? Motion carries. We'll move on to 10, management reports.
Thank you, Chris.
Okay, it's just about.
And hospital operations with Carol. Are you good? Oh, perfect. No, you're fine. It's just always on the agenda, right? Like in case you have anything. So, and then Carly Zamora's not here. Urgent care, Tomas, do you have anything?
No, no updates.
Awesome. Mr. Yarnberg. I know, you should have just went.
All right, so, couple things just to make you guys aware of. We hired an immediate position that I heard when I came on as well to find somebody for interview process and get with the, made it. We still have, yeah. Oh, environmental services. Yeah, they're on track. We still have the opening for, and one obviously for us, so we've actually partnered with them on that process and did interview last week with our, well, as Pablo and Dave, and bringing in personnel, we've had full of new people apply since then, those as well. We're gonna, that person obviously. If we look at the years, that the good news is, FC has a product recently done that and knows how to do that, so that will be a huge help. That's something that we're working on. This past, yesterday, we had our all staff meeting town hall at 7:30 for staff, and then again at 1:30. Had close to 2 people attended and went over numbers that are coming in, talked about our financials, where we're at there, so that financially, and obviously the conversation had to do with merger, where we're at with that, so we gave folks updates, and then opened it up for questions. At that point, lots of good questions. Same, pretty much morning meeting to the afternoon meeting, same meetings. So I think it was really good for our staff. It's a good opportunity for them to be able to be there, ask this question, hear what's happening, hear the direction that we're going. Obviously, for some people, was something that was helpful, and for others, you know, I imagine this stuff out and there's a natural anxiety level, those type of things. So overall, I think it went well. The morning wasn't quite as many there. At that one, about 50 or so session. But well, that's something that we're going to continue. When I was there, and get a lot of work. The other thing I want to make you guys aware of, if you guys recall, a couple months ago, we talked about collaborative that's working on CME program application, being able to bring residents into our that. So there's a large group that is on a read basis here and over things area. One of the things that came out of that, there's a way that the GME program works, opportunity for reimbursement that comes if you put the right way. There's a 5-year period as far as when the process starts, and it's called the CAP. We started receiving some residents thanking to our facility from Hour, and in doing so, we inadvertently started CAP time. So we have to put that on our cost report, which means with that, the group that's already working on that, they're the ones that pointed out and said, hey, eventually going to be an issue. We had a conversation with them this past week about what some of those options are, just to keep you guys kind of in the know of what's happening with that. The one option is you can apply for that individual sponsorship and that individual. And we have to kind of start that process, and there's the timelines associated with that, like our there's a 4-year time frame on the one in particular, which is one that we're very much interested in because and the idea for a GME, just back to that, bringing in residents, gives those folks an opportunity to see what it's like to have a higher chance of bringing them on after the fact than if we were have them, they don't really care. So there's a lot of data to suggest and that supports that their GME program out there are great. And so we definitely want to do it. It's difficult to attract people to, and once you get here, though, it's a complete. That's what we're hoping to happen, go through this process. So we have that opportunity. The other opportunity that we have is to partner with Intercare's sponsoring institution. And that process is already that Eastern Riverside and Imperial County Collaborative. That's the part that we're. So if we go through it from that standpoint, a lot of that hardware pieces will, and we'll have more of an opportunity to make sure that we get things set up the way it's supposed to as we move. So those are, want to be able to maximize this thing. But I wanted, again, just make you guys aware that we do have a clock ticking on that we didn't have previously. So that kind of changes things for us as we look at, well, once you get to that point and that clock goes away, then it's going to be, if we even wanted to try to do something now. So it's so much more else helping us with that bill, pay for that program. So that just, again, wanted to make you guys aware. That is something that's something we need to be mindful of.
Chris, who selects the people? Did you say that there's people?
Like where we receive them from Eisenhower. Doctors like doctors, yes. Yep. So they'll be part of that. They come, in some of those instances, that primary location, will work Eisenhower right over the patient. That could be classified as there's if that as part of, and so apparently doing that except we so just something to be mindful of anytime we have something like that. Even like in those situations, we're not paying those people. They then become a patient that we allow. And pay them for. So even though there's no, we receive monies for it. Did I get that right, Corrado? So Corrado is with Care. He's the brains behind this process and getting it started. So did I say this?
Chris, I have a question.
Yeah.
Speaking of Intercare, as I understand it, a doctor can be hired by Intercare and part of their education is paid for, or there's some debt forgiveness in play there, potential? Is there any way that we can qualify for a program such as that? Would be a great recruitment
Right.
tool as well.
There are some ways for that. There are certain things, criteria they have to, and we haven't met that criteria. The HIPSA score that, and as a federally qualified healthcare IVHD, that's what they are. They have a different set of rules than we have in our age. So the same guidelines aren't the same. The FQHCs are reason why they even come out is because it is supposed to help for those communities that have a population base that's more Medicaid and how that kind of stuff have that absolutely. But they also provide services such as like that are part of it. So they get different grants that they'll qualify for. And technically those are kind of the programs like that. There'll be different criteria that FQHC, that criteria might be criteria there, but for us, that's kind of how some of those, and some of them are just specifically for an FQHC. We have some of them. Those are all things that we're
And then this might be like a more of a curveball to Pablo. Does the UCSD have any kind of program to where if a student, graduates through your program and they come into your system, is there any kind of incentive there?
Here. The end of those. Put additional. Pay. I see. Established hospitals that and didn't allow. But that. Event. As students. Not able to.
So with that, the other thing, just to make you guys aware of, that was something it done a while ago with, away. We brought it back. Was very, very well attended. Actually, I was very surprised by that. Some of the vendors that we had out there that were also. Did kind of bribe them a little bit to go through and that they got a ticket when they were. But it was very well attended, very well. That's what some of our new folks that are coming on our benefits. That's they were there. Last thing I have on my list is just a reminder about hospital nursing week coming up the 11th May that week. So the 8th board meeting, I got you guys to give me your prizes, got those t-shirts in, so 8th board meeting. That's my report.
Thanks, Chris.
Thank you.
Thank you.
Adriana, do you have anything?
The substance of my report under the closed session items, but just open session in case anyone missed it, the deadline to submit Form 700 was April 1st. Elected officials for last calendar year. You all, I believe, filed your student office form here. I want to remind you about that deadline date and haven't 700. And ask, let me know if you have. Otherwise, no reply.
Perfect. Do you have any items for future agenda? No. If not, then we'll break into closed session at 7:27.